Dressler syndrome is also known as post-acute myocardial infarction syndrome and is characterized by an immune-mediated fibrinous pericarditis, usually about 1 to 8 weeks after a patient has a myocardial infarction. So a little bit of history. This syndrome was actually first discovered by Dr. Dressler in 1956, and he was describing it in about 3 to 4% of his patients. Usually these patients would present with malaise, fever, typical chest discomfort, and most importantly, pericardial effusion, which is a big symptom that's associated with this syndrome, Dressler syndrome. Now, pericardial effusion is characterized by an effusion or buildup of fluid within the pericardium. This is the sac that surrounds the heart. And it's not to be confused with cardiac tamponade, which is essentially the same thing but leads to compression of the left or right ventricles, thus leading to impaired diastolic filling and decreased cardiac output. So in comparison, pericardial effusion is rather benign. While the underlying pathophysiology here is still kind of under debate, what a lot of people think is over here we have our necrosed myocardium from our transmural infarction. This leads to the exposure of many different cardiac antigens that are, of course, immunologically active. So these immunologically active antigens could increase the chances of you having an autoimmune response. It takes about 1 to 8 weeks for the body to build up this autoimmune response, and it's usually antibody mediated, or that's what they think it is anyway. The patient will typically present with labs such as increased leukocytes. This is because this is an autoimmune disease. And of course, we'll see an increased ESR, or erythrocyte sedimentation rate. Of course, with an autoimmune reaction, we're going to see increased levels of C-reactive proteins within the blood, and these proteins are actually going to cause the blood to settle out more quickly when we put it in a tube. Now, the treatment here isn't very high yield because with the advent of new reperfusion therapies, we actually don't see Dressler syndrome very much in the clinic anymore. That's why a lot of clinicians say that Dressler syndrome is, quote, dead. It's a very, very rare complication now, but it's still very testable. And the way that they would treat it is usually with an anticoagulant like aspirin. One thing that you want to note is you don't want to use glucocorticoids here. Even though this is an autoimmune disease, you don't want to use glucocorticoids because they will actually interfere with healing of the myocardial infarction. Remember, this is a syndrome that happens 1 to 8 weeks after an MI. So if you're impairing the healing of the necrosed tissue, you'll actually leave the patient open to suffer other complications like ventricular free wall rupture.